registered social worker by trade, and that is sort of my background context. Professionally, I've worked in social services for just about 20 years now, but I live not only in Manitoba, which everybody equates near Winnipeg, but I actually live 5 hours outside of Winnipeg as well. So I'm halfway up Manitoba. And one of the pieces there is that we're short on resources. I mean, even in the large centers, there's not enough resources. And out in rural Manitoba, that much more so. So I got my degree late. I worked as volunteer positions, I worked as peer positions, and then I decided to go into social work because I was actually upset about some of I've had 20 years of being in the mental health system, and that taught me a lot of things. And I became pretty passionate about some of the systemic wrongs that were being done to people when they would go and access help. So I thought, if I'm going to change the world, I need to be a part of that team. So I can sit at the table and say, I don't think so. I don't think that's a good idea. Do we realize what that does to people when they're telling us that story? So I got my social work degree. Social workers, I'm going to do a little plug for social work because sometimes we're undervalued. And I say that in the sense that nobody really wants social work at the table until it's so complex that they're like, call that social worker in here because we're done figuring out what to do, and they'll just deal with it. So it's this bizarre play. But essentially social workers were trained in systems, completely trained in systems. So what I find is our job oftentimes, we're not looking, when a person comes, and I'll do individual work, I'm not looking at what's wrong with that person. If anything, social work we're trained in strength-based perspective. So I'm looking at that person, you're sitting here, something's going right. So let's figure out what that is. And then the rest of the time, what we're looking at is what's in your environment that's not matching what you want or where you want to go. So it's not about what's wrong with the person or what they're not doing right, but it becomes more of a question of how do we maneuver the environment around that person so that they can get their goals accomplished that they want to get done. So that was where I start professionally. I've done my time in CFS, mental health, domestic violence. I've worked at a lot of different places. And these last two components is what pulled me into chronic pain. Our journey, I have 3 children, and I have a 6-year-old daughter. She's our middle child. And actually, we've been on the journey for 3 years, but literally 2 weeks ago, we got the official diagnosis that she's got EDS, hypermobility type. She's quite severe. I have it as well. And I'm in the process of, everything in my life has been attached to mental health or being fat. And I'm going to throw that there and be honest. Even when he checked my joints, he said, that's pretty loose. And I said, no, that's fat jiggling. And that was my response, because that is how, and I'm going to talk about that later, about that systemic training that we receive. When you are told to look at things in a certain context, you tend to move forward with that because we want to be compliant. There's nobody in this room that wants to be rude, that wants to be back in a corner, that wants to be angry at the doctor. We all go forward with that intent of, I just want some help, and what do I do? So there's a picture of my 20-month-old now, and it was actually, when I was pregnant with her, my pelvis separated, completely came apart. I lost the use of my legs, and what they told me was, it was my anxiety. They did an x-ray the day after that baby came out, and that was when they realized that my pelvis wasn't even connected anymore. That was one of the first driving forces. I got mad. It took me 20 years, but I finally got angry. There's my 6-year-old daughter. That is when she's doing well. Her name's Olivia. And she's small. She's very small for being 6. And she is the driving passion for both personal and professional, why I've become so attached to this movement now, because what is happening out there, and you guys have all experienced this, there are massive cracks and holes, and it's not fair. So we're going home thinking, what am I doing wrong? How do I find the fight to fight this another day? And I was thinking for a long time that I was all by myself. I'm not all by myself. Look how many people are in this room. So to land in places like this where we can talk about that, and you look at the person next to you and they're like, yeah, I get that. I said, what if I come up here and I fall down? This group will understand. I'll just be like, toss me the mic, I'll keep going. Because you'll get why I just fell down. So, when we talked about what topic am I going to talk about, because social work covers all sorts of different things, I thought about what is the thing that has been the most powerful on our journey and has also been the most hurtful, and that has been communication. Communication is so simple, yet so complex. So it tells people what we need. The interesting thing is that there is no human behavior that is done for nothing. None. Stop right now what you're doing. Take a look. You're doing it for a reason. Sandy's rubbing her eyes. There's a reason for that. There are reasons for our behavior. It's whether or not we know about it or not. That's the trick. So how aware are you of the link? And so why is communication so hard? The good old, see, I don't hear and I don't speak. That's why it's hard, because communication means that we have to sometimes look at our own vulnerabilities, and the person we're communicating with has to look at theirs. And that can be really tough, because we don't want to. I want to feel effective. So if I have to think about what a jerk I was, I want to make it that guy who was a jerk. I don't want to think about my participation in that conversation. That guy was the jerk. And that's why communication ends up getting very difficult. So where do we start? We go in, we have our first symptom, and we're thinking, I'm going to go see the doctor. So we think it's a linear, I'm just going to go in, I'm going to run the course, I'll hit the finish line, it'll be clean, I'll know what to do next, it'll be A, B, C, D, E, F, G. But the reality is it looks somewhat like this. And there comes a point where we're not even sure if we're going ahead or are we going backwards, or maybe we're even going sideways. And it becomes really complex. And in the midst of it, we lose track of ourselves sometimes because we're just trying to get to that finish line, because that's where we think it's going to be better. If I get there and I'm done with it, then life can begin. We've ended up in a place with EDS that there is no end line. Life is right now. And that's what we lose track of. So the question, what if we all think 1 + 1 = 2? What if it doesn't? We all start off when we're 5 years old and we're thinking about where life is going to go. 1 + 1 = 2. Clean, easy, all our friends are doing it, it's all going to be good. And then for some of us, we end up on this journey where it's more like 1 + 4 = 17,000. And it doesn't make sense to anybody, and it doesn't make sense to us. But that's where our depth begins. So communication is key. We heard from the doctors this morning. Communication is the most powerful tool everybody has. Patient, doctor, friend, family, mother, daughter, anybody. It's the most powerful, but it's also the most underutilized or the most ineffectively used tool. And we can all have those questions. I think of those conversations you've had that you realize, like, wow, that did not go well. I know I've had them, especially in the doctor's office, because we've encountered all of those difficult things that everybody does, and it's, how does this connect? And I'll look back on that and say, like, that went south pretty fast. That went south really bad. So communication is hard. It's not black and white, it's very gray, and it involves our emotions. And so if we're not aware of those when we enter into a communication, they're going to shine through, as they should, but if you're not aware of them, the risk of that bleeding over is there. I heard somebody say, well, if I can talk, I can communicate, it's easy. I just have to say, you know what, this is my problem, help me, and we're all good. Except that it's not that easy, and I'll show you why. Self-reflection is also very uncomfortable. It is. We don't want to look at the things that we're vulnerable at. We want to feel effective in our lives, especially when we're put in scenarios where we feel like we're being backed into a corner. Chronic illness backs you into a corner. All the systems around you are sending messages saying, it's not good enough, it's not right enough, that's not working, this isn't working. And so it becomes all about what's not going right. So you're backed into a corner. At which point, if we do self-reflection, we feel super vulnerable. And that's not a very good feeling for us. So as human beings, we tend to want to avoid that. So systemic training. This is my self-realization. Patient experiences. So it's an interesting loop. And this is why I call it systemic training. So we're told by the system to get well. But in order to get well, we have to be perceived as ill. But get well, but don't get too well, because then we're going to cut resources. So it ends up being this weird loop that we're all a part of, but nobody's really talking about the fact that program criteria exists, so you will get in. Program criteria is based on what's wrong with you. And that's the way our society's set up. That's not your fault. That's not the doctor's fault. That's not anybody's fault. That is the society that we live under. But what it does is has that unconscious messaging. What's wrong with you? What's wrong with you? What's wrong with you? So sometimes we need, when we've been told that our illness is not actually accurate, then we get thrown into this whole other loop. Because we know we're not feeling good, but we're being told that that's, well, sure, you look fine. So then how do you show people that you're not feeling good? You have to really not feel good. And not on purpose, and I don't want to make it sound like that, but that's one of the pieces that's missing, is nobody ever talks about that messaging from up here that says, you need the resources. How do you get the resources? You have to be sick. No one's going to go to the doctor saying, I'm a rock star, and that's why you need to get me a brace. Because I've got lots of goals I need to get done, so give me the braces for my knees and I will show you what I can do. At which point the doctor will be like, do it anyway, right? You sound like you've got it together, go. So it becomes this very interesting play. So in our heads, the fear and questioning begins. It also begins on the professional side of things. And sometimes that plays out. The playground analogy. Again, when we look at that 1 + 1 = 2 scenario, we're all hanging out in playground A. It's a cool place to be. That's where we want to be. That's when things are going really well. And that's what we want to do. And then the SH hits the fan. And then we said, welcome playground B. No one tells you you've been thrown into playground B. All you know is that you're looking around and you're realizing that it's not the same anymore. You're peeking over the fence at playground A, saying, are you guys going to let me back in? I want that old fun time. I want to be with you guys. If the gate opens back to playground A, you sit there and you look around and you realize, I don't even know if I fit here anymore. I don't know. I want to be here, so I'll put on a show to be here, but I don't think I fit here anymore. So what do? This is where expectations around communication are important. Everybody has expectations around what they're looking for out of a communication. So William Shakespeare's famous quote, expectation is the root of all heartache. Because again, when we have expectations that can't be met, what happens? Our heart breaks a little bit. Or I feel like I'm waiting for something that isn't going to happen, which in chronic illness is a common thought. Communication, and this is where we have to temper, we can only control what we control. This scenario, so we've got the lady on one side and the guy on the other. Communication is this person thinks of something they want to communicate. They think of the word, it comes out, this person receives it, and it processes, they think of a response, it goes up, out, boom, boom. How many places for error are in there? It's huge. You can say all the right things, and if this person interprets it differently than you anticipated, it's going to go differently than you expected. That's why we have all these wonderful communication techniques about clarifying. What did you hear me say? All of those wonderful pieces. So what do we do about it? Especially when we're connected to the medical system. Know the purpose of your communication. One of the things we discovered is we're attached to so many specialists. I really had the expectation that if we went to go see a kidney doctor, he was going to be able to tell us everything that's wrong with her all over the place. That's not true. He knows about kidneys. So I had to start tempering, knowing that if I was going to go meet with the kidney guy, we were going to talk about kidneys. And that was it. And I had to be okay with that. Remember the potential for errors and ask for clarification. It's always way better to clarify somebody's statement, especially if someone says something to you that triggers you. You can feel that anger or that heartbreak. It's okay to look at that person and say, you know what? I'm just wondering, this is what I heard you say. Is that actually what you meant to say? And then in those moments, you have an opportunity to give yourself some time, but to also clarify the statement, because that may not be what they anticipated, but it was the way that it was processed. Team members come in surprising forms. I've had, I think, probably about 4 conversations today. No one likes to hear I think you need to get a referral to psychiatry. I think you need a referral to psychology, or I think we need to bring a social worker in here. For our case, those team members have been our most valuable ones. Because this is a struggle. And I'm not above saying that it's not a struggle. It is. It is really hard to parent this kid whose behavior goes off the wall because she has so much pain and nobody knows how to help her. That's a struggle. So I've got my team that I work with, but they also are the ones that have written the letters saying, there is something medical going on. I'm not putting this child on any psychiatric medication until you guys figure out what this lab work means. They have been an advocate for us and have helped us push our case along. I know we're lucky, we got her diagnosis in 3 years. And how sad is that? But I know we're lucky. But 3 years, and she's 6. We've got a whole lifetime that we can do things with her. And that's one of the reasons why, those surprising team members that came to bat for us. Check your own as well as others' expectations. We talked about going and seeing the specialist. If you're expecting that the kidney doctor is going to talk about the brain and the inflammation, you're going to be disappointed. You also have the right to say, what are you expecting from me? Because sometimes what they're expecting you to deliver is not necessarily what you came to deliver. And again, it's okay to ask that. Before you start, what is it that you need from me? Because the case file at this point is 3 volumes this thick. Where are we going to start? Because I know you don't have 2 days for me. I got 15 minutes. What is your expectation of what we're going to cover? Self-reflect, especially when you're running on empty, which is all the time. Have a safe place to tell the remaining parts of your story. That has been the most powerful thing, and that is why this exists today and why we're here this afternoon. There are appropriate places to share your story, and it gets really frustrating when you're sitting in those offices. I felt it myself just the other day. We had to get a private OT assessment because we don't have any OTs in our area that could see her. So I want to tell them the whole thing, like the whole thing. And I realized that's not the place. That's not the place. So I have to make sure that I've got my team in place, friends, colleagues, family, whoever it is for you, that you can tell those remaining parts of because your story is important. And telling your story is what helps you get through to the next step, because you realize that you're not alone and you're not going sideways and you're not going backwards. And if you are, your team is going to give you the little bump in the butt to say you got to get back on track. So refill the tank. Again, the social emotional part of self is critical and overlooked all at the same time. We all know, society knows, take care of yourself, meditate, do things that are going to make you feel really good. How many of you actually do those things? And I don't need a show of hands, but really think, how do you really fill your tanks? Because for everybody it will be different. And that part is a challenge, because I know for myself, sometimes I feel like I'm doing it on the toilet, to be honest, because that's the only place where I can lock the door. And I don't have a 9-year-old, a 6-year-old, and a 20-month-old saying, mom, 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 mom. I work full time. There's a lot of stuff going on. I have to figure out a way, because I'll drown in it. I will absolutely drown. So, there is my blip on communication. I kind of went cruising through it a little bit quickly, just because I know it's at the end of the day. There are so many pieces to the journeys that you're on. Honor as many pieces as you can and share those stories with people around you. On the communication side, make sure you're sharing it with the people where it's appropriate to share. Because the expectation, I know myself when I walked in, it was like, you know what, family doc? Here's the story, and you're going to help with all of it. He was overwhelmed. There's no way he can work with all of it. And so I had to figure out a way of, okay, this is your slice of the pie. This is my slice of the pie. And this pie is going over here and over here. And then what I found over a while is that it became much more of an effective model, because everybody lasted longer. Because to hand the whole pie over to somebody, they got burnt out, I got burnt out, and we didn't really get anywhere. So, questions, comments, concerns. I think there's like 1.5 minutes. How's that for a nice way of getting out of questions? Yep. Is there one? Shout them out. I can't tell. Are you actually pointing or?
You know, I'm asking.
Okay.
I was going to ask you, so when you're going to, you just sort of touched on the subject of how do you communicate to your GP, who is supposed to be central station for all of the people who are supposed to help you find this diagnosis, and then come together. So how do you communicate with your GP without overwhelming them and yet, having them be central station?
Well, and I guess, I know Sandy's pointing her hand as well, but one of the questions I would say is, does that person know that that's what the expectation is that they're going to do as well? Because not all of them do that. And that would be one of the questions to ask right up front. To say, are you comfortable being case manager of this case? Because, or do you recognize that I'm expecting you to be case manager? Because not everybody knows that that's the role they're going to be playing.
Well, when you've had a doctor for 20 years and you've progressed over years into, or degressed or regressed or whatever, it's kind of like how do you address them?
So I think that Roger, can you mic up?
Make sure I'm not heavy breathing into the mic.
One of the things that we do is, as part of ILC support, is to help people navigate the healthcare system. And it really is building that strategy. So the person who is ultimately responsible for your health is your GP. And if you don't have a GP that's willing to work with you, then it's important to start trying to find a different GP that will work with you. Now, from our experience so far, the people who have a GP that's not been willing to go to the next step, who doesn't believe that you are living with this condition, and there's frustrations, we recommend that you go and ask for not just a regular appointment, go in and have a talking appointment. And that way, he or she is not feeling rushed and pressured to be able to cover all the things that you want to be able to talk about in that 10-minute window that he probably really only has 5 because they overbook. So begin by asking for a talking appointment, which is typically a 40-minute appointment, and then you can ask for longer. So that is one of the strategies. And then, to what Marli was talking about is being very clear and specific on what it is that you need today, and take it one step at a time that way. But to your point, it is very frustrating, and we help lots of people get different from the doctors.
I was just going to add as well, one of the pieces of work that I do is I do support group facilitation. And it was really interesting because we did an exploratory around what our expectations were that our GP could give to us. And there were a lot of expectations that the GP would fix. The answer was he's going to fix me. And so then the conversation flowed out. Hands down, like that is the expectation, so that's where we start. But at the same time, is that realistic? And can you be fixed? And what if you're not ever fixed? And what is your responsibility in there? And that's one of the, and those are uncomfortable questions on our side and on theirs. But it's important to explore that authenticity when you're dealing at such a level of depth around a chronic illness. This is not a simple illness. It's not. And so it's really even more critical to have those really authentic conversations both with yourself, so you know when you go in there, are you expecting to be fixed? Are you expecting them to know where to refer you to? Because chances are you might know where to refer yourself, and then you go there and say, can you help me with a referral over here? Because I've done the research, because I had time. So those are some of those balancing off questions. There's some amazing GPs out there, amazing GPs.
Good. Okay,